Right. Now, what about people that, are device obsessed? The
Oh,
biggest question we get from clients is like, well, what can I do in the meantime? And then there's already a messy neck going on, and they're like, well, what device can I use? Can I use alt therapy? Can I go in and do some microneedling with radio frequency, fractora, profound? What could I do, Melinda, just to hold me over? And I tell them nothing. I don't believe in the holdover. I'm not a fan of the non-invasive industry, and I think that the way to fix this is to do it the once and to do it the right way, while the tissues are not denatured and they're in their natural state. So, talk to us a little bit about what you find when you go in there with these patients that have had all of these non-invasive procedures done.
well, that is really a great question. And I know that some of these people have had all these radio frequency treatments, make it much more difficult to get a great surgical result, and that we're having to work around some really scarred up areas. Somebody put through a question, I think you probably saw it, would Kybella work in this patient? And
Right.
so I think Kybella would just be a disaster for this person
I
because
agree.
you'd end up with a lot of extra skin here. And I had somebody come in just recently who had Kybella in her neck. We're going to be now doing a facelift on it. It's going to be much tougher to do her facelift because of the Kybella that she's had in this area. It's given her irregularities, and she said she was swelling for such a long time. So anyway, I think that Kybella in these regions like the jowls, that's not been approved, but a lot of people are doing it. I'm not a
Right. The
fan at
off-label
all. The
Kybella. Right.
off-label. What I want to show you for her in these MRI studies we did, again, these are studies not on our patients, but just on over 100 of the people at Brown University. And you can see this nice layer of fat that we have to work with. And so that's something that we can sculpt and contour surgically in a much better way. So what we did for her is take away these jowls and then be able to give her this jawline back again, a smoother jawline, get rid of this downturn here. So I don't think Kybella, because it just takes care of the fatty tissue. And
Right.
so I think the radiofrequency treatments, those things that you asked about, great question. I'm not a fan at all because it makes it so much tougher to get the smooth results that we're looking for surgically and to be able to take control of these areas, this downturn,